Martha?
Hi.
Hi, how are you? My name is Concepcion. I'll be taking you back for your exam.
Alright.
Alright, you can go ahead and follow me to this room. Okay, you can go ahead and take a seat on the bed. Can you confirm your name and date of birth for me, please?
Sure, it's Martha Arthur and born October 28th, 1997.
Okay, perfect. Can I see your wristband very quickly?
Sure.
Okay, perfect. And do you know what kind of exam you're getting done today?
My doctor ordered a pelvic exam because I've been having a lot of pain on my left side.
Okay, how long have you been having that pain for?
About a month.
Okay, and what type of pain is this? Is it sharp, dull?
A mild and consistent pain.
Consistent. Okay. And do you have any other symptoms? Any nausea or vomiting?
No nausea or vomiting, but I do feel bloated, like full in this area.
Okay. And are you taking any medications, any birth control?
No.
No? Okay. Do you have an IUD?
No.
Have you ever been pregnant?
No.
When was the first day of your last menstrual period?
May 2nd, 2020.
Okay. And have you had any pelvic surgeries done before?
No.
Do you have any family history of pelvic disorders?
No.
Is this the first time that you're having any pelvic issues?
Yes.
Is this the first time you're having a pelvic exam done?
Yes.
Okay. So for the first portion, we're going to have to need your bladder full. Did you drink the 32 ounces an hour ago?
Yes.
Okay, so you feel like your bladder's full.
Yes.
Okay, so for the first part of the exam, I'm going to be going over your lower abdomen / pelvic area with a transducer and some warm gel. I might have to press a little bit, which might be uncomfortable for you just because you do have that full bladder. Once we're done with that part, I'm going to have you go to the restroom and empty out your bladder, and then you're going to have to undress from the waist down, and then we're going to start the transvaginal portion.
Alright.
Okay, so for the transvaginal portion, I'm going to need you to sign a consent form just because this is an invasive exam. So I'm going to have you, undress from the waist down. You're going to come back in here. I'm going to have you put your feet up in the stirrups. I'm going to show you exactly, when we come back from the bathroom, I'll show you exactly how it's going to be. I'm going to have this transducer. It's going to have a protective covering, of course, for hygienic purposes, and then some gel so that it's comfortable upon insertion. So I can give you the transducer underneath the cover and you can insert it yourself, or I can insert it for you, okay? Whichever one you're more comfortable with. But, I'll go through it again with you when we get to transvaginal portion, just so that you're not surprised when we're starting the second part. So before we start the exam, go ahead and sign the consent form if you're comfortable with everything I just explained, okay?
Alright.
Okay, and then just know at any point in the exam, if you feel uncomfortable, whether the transabdominal or transvaginal portion, you can, let me know, and then we'll stop the exam. Even though you signed the consent form, whenever you don't feel comfortable and in any pain, we'll stop the exam, okay?
Alright.
Okay, so let me go ahead and wash my hands and put some gloves on so we can start the transabdominal portion. Obviously, I'm going to use soap and everything, but yeah, and then I have my gloves. Okay, so for the transabdominal portion, I'm just going to take some warm gel. Go ahead and lie down.
Alright.
So I'm just going to have you lower your pants to your hips. And then, I know I'm not going to actually show your tummy, it's fine. And then I'm just going to take the transducer and go over like this, okay?
Alright.
Okay, I'm just going to take a couple images. So the transabdominal portion is done. Okay, so now that the transabdominal portion is done, we're going to do the transvaginal, okay?
Alright.
Okay, so I'm going to take you over to the restroom where you're going to empty out your bladder and then put on the robe. Okay. So go ahead, empty your bladder, and then put on the robe with the opening in the front, okay?
Alright.
Okay, so go ahead and lie down on the bed.
Alright.
Okay, I'm gonna put this over you to cover you up. Okay, make sure you're all covered. And then go ahead and put your feet up on the stirrups.
Alright.
Alrighties. And then make sure your bottom is lined up to the edge of the bed, okay? Okay. You feel the edge of the bed on your...
Yes.
Okay. Perfect. So, I am going to put the protective covering on. You see that I'm putting the hygienic cover on, the gel. Okay, so would you like me to insert it for you, or do you want me to pass it to you underneath the covers and you insert it?
You can do it.
Do it? Okay. Okay, so I'm about to insert, okay? Let me know if you feel any pain or uncomfortableness, okay?
Okay.
Okay, and we're in. Okay, so I'm just going to take a couple of images, okay?
Alright.
Alright, so at any point, remember, you can stop me and let me know if you're feeling any uncomfortableness. We'll stop the exam. You can ask me any questions throughout this report, but also know that I'm not allowed to talk about any of the findings with you. You're going to have to wait to talk to your physician about the results, okay?
Okay.
Okay, so we're just going to continue this part of the exam.